COVID numbers are slightly down in Victoria this morning, while police are still having to deal with people breaking the rules. So this morning it's just been revealed 221 new locally acquired cases have been reported today, down from those 246 from the last 2 days. The source of 123 of those infections from today is still under investigation. The state looks on track to reach the 70% first dose mark earlier than expected. More than 61% of the eligible population has had one dose, while more than 38% of Victorians are fully vaccinated. Reporter Steph Ferry joins us now from Melbourne. Steph, g'day. At least figures down from the last couple of days.
Good morning, Joe. Yes, that is some heartening news to see that the numbers are at least levelling at the moment. So at least we're holding the line at this stage while we race to get to that vaccination 70% of adult population threshold that now is starting to creep back earlier than that September 23rd original date. It got back further by quite some days now. So hopefully with additional doses and more clinics that have been opened up as well, which is what the Premier is talking about, we will be able to get to that threshold even faster. But these numbers are off the back of some 42,400 test results that were processed overnight. As you mentioned, there are still 123 cases that are still unlinked, and so they'll be trying to fit those into the puzzle at some stage, and that now raises our number of active cases across the state to 1,920 infections. So at least, we are holding the line, I'd say it that way. I mean, we're not certainly going down dramatically at all, but we all anticipated that this would be the situation. The Chief Health Officer, Brett Sutton, yesterday said that the majority of our yesterday cases were just in 8 local government areas, and particularly the north and west of Melbourne continues to be of some concern. So he was talking about a plateauing yesterday, which at least hopefully might mean that we can get those vaccination numbers up as quickly as possible and get out of this.
And Steph, explain for us where you are there and what happened there last night.
Yeah, so here I'm in Ripponlea, which is just in Melbourne's southeastern suburbs, and right behind me is an Orthodox synagogue where there were quite some dramatic scenes yesterday. Now, what happened was that it appears as if people had gathered here, members of the ultra-orthodox community, to worship basically for Rosh Hashanah, or the Jewish New Year, and that was in breach of the Chief Health Officer's directions. Now, police surrounded this area, and basically it was a waiting game yesterday until just before the moment of curfew starting up around 9 o'clock last night. When people started to come out, they were greeted by other members of the Orthodox community that had also congregated outside as well, the synagogue, watching what was unfolding. And as soon as police confronted them to try to get their names and details for potential fines, this is what happened.
Hey, get out of his way. He's taking videos of us. Yeah, he's allowed to. No, he's not. Yes, he just said it. He just said it. He's not around my face.
This gentleman hit me.
So really some violent scenes. In the end, what happened was that police say that they are going to be issuing all adults with fines of $5,400. There were also children that were present at this gathering, but they will not be fined. And police are also trying to find some of the people who fled during the night as well from here. And during this whole situation, one of our cameramen was actually struck on the head. Now, he's received quite a blow. He is still in the Alfred Hospital at the moment. He was treated for concussion, and so police will also be investigating that alleged assault as well on him. So it was clear that this was quite a confronting scene here last night, and we have heard from many members of the Jewish community that have been stopping to chat to me here as well, just to say that this is definitely not representative of the wider Jewish community. In fact, we heard from the local member of this area, Josh Burns. He said that the actions of these very few worshippers here were quite appalling in his words. He said that now is the time for the community to dig deep. We are all frustrated with these continuing lockdowns, but it's even more important that people abide by these restrictions and everybody is equal in the eyes of the law.
It's a very small number of people, and the majority of people are doing the right thing. And just like the majority of the broader population is doing the right thing, but it's deeply frustrating. One of the great things about the community locally is that people do come together, and it is a very tight-knit community. But most people will be looking at these images going, "This is appalling," and most people from within the Jewish community will be looking at these images going, "This is appalling." And people have been doing the right thing, and I would just say that for this small number that's not, it's very disappointing.
And his comments have also been backed up by the Jewish Communities Council. They've issued a statement because, of course, it is a Jewish New Year at the moment, so it is difficult for them to comment during this religious observance. But they have said that they have expressed their strong disappointment and condemnation of those who breached the lockdown, that they have gone to great lengths to encourage the local community to be able to observe this religious period at home. And in fact, we heard from the Premier yesterday saying that special arrangements had been made for people to be able to observe that at home. And it also says that the actions of a few, once again, don't represent the wider Jewish community here.
And Steph, on another subject, how does Victorian Premier feel about how the federal government has been going about the vaccination rollout?
Yes, well, he really did lash out at the federal government in relation to the vaccination rollout after it emerged that following the extra doses that had been given to Sydney and to New South Wales to help contain the outbreak there, they were the doses that had come from Poland, that there seems to have been even further allocations that were distributed to New South Wales GPs at the cost of some of the other states. And in fact, that Victoria had received less than its pro rata or per capita share of the vaccination doses. Now, he came out strongly and said, while, he wasn't trying to necessarily push up the debate at all, he did say that it was clearly a race, and he didn't know at the time, in his words, that Ms. Berejiklian was in a sprint while the rest of us were left with an egg and spoon thing. And he also said that it's clear that if this is a race, then it needs to be on the same sort of racetrack and with the same finish line as well. He said that this state was not going to be doormats, and they weren't going to sit there out of politeness and not put their hand up and say that this situation was wrong, it needed to be fixed, and we needed to get our fair share of doses so that we can as well get to those thresholds that we all so desperately want to get to here in lockdown 6 and be able to get out of these restrictions. Now, we heard from the Federal Health Minister, Greg Hunt, who did counter and say that Victoria in the past had received additional allocations when we had been in an outbreak situation as well. But clearly, while we are in this race to be able to get to our 70% and 80% threshold so we can emerge out of lockdown like everybody else, then we want to be able to see as many of those vaccines come across to the Victorians as possible.
Okay, Steph Ferry reporting there from Ripponlea in Melbourne's southeast. Let's head north into New South Wales now. New modelling shows there could have been 500,000 COVID cases and almost 6,000 deaths in New South Wales without the lockdown and vaccine rollout. The state recorded 1,220 infections and 8 deaths yesterday. There have been 139 fatalities since the outbreak began back in June. The state is expected to reach single vaccine dose coverage in 3/4 of its population today. More than 74% of people have had their first dose. 41% are now fully immunised. Reporter Lara Himes joins us now from Balmain in Sydney's inner west. Lara, g'day. We're still in a COVID crisis, but the modelling shows the state has, it shows the state has avoided a catastrophe.
Good morning, Joe. Well, it's important to note that the modelling that we've seen from yesterday is essentially just an extension of the modelling that we saw the day before. So it is linked to the Burnett Institute, and that's where we saw the initial statistics and trajectory of how the virus was going to impact, particularly the New South Wales health system. So what we've seen is that with the vaccination rates that we've got, the rollout, and also the lockdown restrictions, what we could have had is nearly 500,000 cases of COVID, particularly in the local government areas of concern, so those hotspots, and expectations of about 6,000 deaths. Now, if you relate that to what we're actually seeing at the moment, in this particular outbreak, we're on about 30,000 cases of COVID, and tragically we've had 139 deaths which have been linked to Delta. So you can see there's a big gap into what the measures could have been and what we have seen. Now, we are on track to be getting to that mid-October milestone of double dosing by then. That's also the time that we're expected to reach the peak ICU admissions. Now, we know that that's going to be around about the same time that we'll see an easing of some of the restrictions. That is something that the Premier has come under fire from some quarters of the community. But one of the justifications is that even though we'll see a peak in ICU admissions then, we'll actually see the peak in COVID cases about 2 weeks before, because obviously there's a lag between when COVID is contracted and the time of which an individual goes into hospital. There's also been some mixed reaction within Cabinet, and there is going to be a crisis Cabinet meeting today about what it will look like on how those restrictions are going to be eased. We know that the State Treasurer, Dominic Perrottet, today has been quoted by saying that he wants all of Sydney to open up at the same rate, where we've had the Deputy Premier, John Barilaro, stating that he would like to see restrictions lifted for parts of the regions where there is no COVID. He says that you can't suppress something that doesn't exist. So you'd expect some interesting and various canvas views to be heard today at that crisis cabinet meeting.
And where are you there today, Lara?
We're sitting here at the Dawn Fraser Baths. This has been really good news for the people of the Inner West. This historic venue has now been reopened after 2 years of a refurbishment. It's worth about $8 million. And one of the reasons why it remained closed for so long was that it was not included in the public health order of venues that could be opened. Now, currently, under the public health order, we know that aquatic centres can't trade or be opened. However, ocean pools are exempt from that because they're a natural body of water. We've seen in the eastern suburbs of Sydney that Bondi, Bronte, those areas have been able to be open. This has now joined the ranks of those other ocean pools, and it's been a real big win for people in the Inner West who have been really craving their morning swim. Very brave, I might add. Wouldn't have gotten there at 12 degrees this morning, but they've been welcome news nonetheless.
Good stuff, Lara. And this is the point at which you pull back your hair under a fetching swimming cap and reveal yourself in the one piece from your days in the Olympic swim team and jump in the baths there.
Well, the only thing is, Joe, try to organise a game of Marco Polo, but all of a sudden everyone's left me.
Well, it looks like there are plenty of people there to join in, Lara. That's no excuse.
I don't think they want to play my game, though. They're more interested in doing their fit and morning swim. So I'll sit here on the warm bench of the sun with my wools on.
Okay, looks glorious today there in Balmain in Sydney's Inner West, and great to see some people doing laps there and enjoying the freedom of being able to participate in there this morning in Balmain. Okay, cheers, Lara. Turning now to the situation in regional New South Wales, reporter Bill Ormond joins us now from Wilcannia in the far west. Bill, g'day. So New South Wales Health Minister Brad Hazzard visited there yesterday. Take us through what happened.
Yeah, good morning, Joe. Yeah, the Minister visited yesterday. He touched down around lunchtime, visited places like the Wilcannia Hospital behind me, spoke to a lot of health staff, and then he went on and visited the tent city for health workers and emergency workers, and then went to the local food bank. Now, that food bank still delivering hundreds of hampers every single day, and they're getting tons of food, literally tons of food come in. They had another semi-trailer yesterday, and they already had a full shed, so it's good to see. Now, the Health Minister, we did speak to him briefly. He did admit, the response could have been better. He visited the motorhomes that were installed over the weekend. He said, they could have been there faster. There should have been sort of more planning in place, but hindsight's 2020. He did say, though, ultimately he really just wanted to get on the ground and see for himself what's going on.
This is purely and simply a learning exercise from my point of view, and make sure that everything that needs to be done by New South Wales Health and by the government and all the non-government organisations that are working with us are all doing what needs to be done.
Yes, so Bill, is it about 10% of the population there is now positive with COVID, and what's been the reaction from locals to that visit by the Minister?
Yeah, it's a little over 10%, I think, Joe. It's probably 12 or 13%, which roughly equates to sort of, you're looking at 600, 700,000 cases if this were the equivalent in Sydney. The reaction, a little mixed. A lot of people were quite happy to actually see someone on the ground from the government, someone high up in the ministry. However, a lot of people at the same time sort of aired that frustration that things should have been done faster, there should have been more pre-planning in place, and they could have been listened to sort of 18, 16 months ago in March last year when the first outbreak had hit Australia, and they sort of wanted to lock down and put sort of a ring of steel around Wilcannia. So there was frustration mixed with sort of, I suppose, they were happy to see him. Ultimately, though, you're damned if you do, you're damned if you don't. For the Minister, they just really, the message from locals is that they just really wanted him to go back to Cabinet and fix problems that are systemic here, like overcrowding. Joe?
Yeah, and Bill, what's it like being there in Wilcannia? Just give us a sense of it. In a place where 10% of the population is positive, those motorhomes have been set up over the last several days. Have many of the locals started using them?
Not really. We haven't seen too many people. We actually haven't seen anyone start using them yet, but they will be sort of filtering through the next day or so. I suppose the reaction on the ground, it's getting better. The mood is sort of lifting as there has been more support. We've seen the ADF, the RFS, a lot of police here sort of delivering packages. The mood has improved significantly, but there is sort of that sense of anxiety and that sort of hangover of the frustration that sort of still exists, where people are just, I suppose, a little frustrated with the government that things weren't planned better, and I guess that's not going to go away anytime soon, really.
Yeah. OK, Bill Ormond reporting there from Wilcannia in the far west of New South Wales. The Boondall Entertainment Centre on Brisbane's north side will open its doors today, having been transformed into Queensland's latest mass COVID vaccination hub. Reporter Brittany Klein joins us now from Brisbane. Brittany, g'day. So how many people are expected to come through the doors today?
Oh, good morning, Joe. Around 1,500. It opened around 8:30 this morning, and you can probably see behind me a steady stream of people now coming into the Boondall Entertainment Centre. Pre-pandemic, you would remember this used to be the home of big sporting events and big concerts, but today the floor is filled with around 75 booths where people can come and get their vaccination. You probably can't see, it's quite small, but on the door of each booth it has the Pfizer word, which is the main vaccination that will be available here. Like I said, around 1,500 vaccinations are expected to take place today, 3,000 by next week, and this is all hopefully to fast-track our rollout here in Queensland. We are lagging behind some of the other states. Just 53% yesterday of our population had received their first dose, and 34% fully vaccinated. This hub, though, does have capacity for around 6,000 vaccinations a day, or almost 6,000. And I spoke with one of the nurses in charge who told me this was all pulled together in the last couple of weeks, in addition to the mass vaccination hub already in place a little bit closer to Brisbane CBD at the Brisbane Convention Centre in South Bank. But the good news is, Joe, we had 0 cases yesterday. The Queensland Premier says we're going to try and get as many people vaccinated here as possible, but it's all depending on the all-important supply coming into the state as well.
And Brittany, gee, the memories are coming flooding back for me, seeing the inside of the Boondall Entertainment Centre, going well back to 91, I think it was. Gloria Estefan in all the glory back then. Have you seen many entertainers there? I think the colour scheme is the same on the seats back as it was in 91. Have you seen many performers there?
No, I haven't personally. I'm not a Brisbane born and bred, but like I said, it's just a bizarre environment. This is the pandemic world that we live in. Big venues like this transforms into vaccination hubs to try and get as many people here as possible. Like I said before, in days gone by, this would have been packed out by people here to see Whitney Houston or One Direction, but today they're all here to get their vaccination. I did speak to that nurse a little earlier as well, who said it's fully booked out for the rest of the week, so 1,500 people coming through the door indoors every day this week. Let's hope to see those numbers closer to 3,000 by the end of next week and even more if supply increases.
OK, Brittany Klein reporting there from Boondall in Brisbane's north. The federal government is hoping to roll out international vaccination passports from October in preparation for the resumption of overseas travel, but don't go packing your bags just yet. There's still no time frame on when international borders will reopen. Political reporter Matthew Doran joins us now from Parliament House in Canberra. Matt, g'day. I think it was important to put that caveat in the intro of this story because people's hopes have been raised pretty quickly. What can you tell us about how these passports will work?
Yeah, we're not talking about knocking back beers on a beach in Bali anytime soon, Joe, but this is a very important step in preparing for the return of international travel, ensuring that Australia's systems and procedures are in line with the expectations of a number of other countries right around the world, which are now asking people who come through their airports to prove their vaccination status. So these passports, which the government is hoping will be available from October, will allow Australians to prove whether or not they have had the coronavirus vaccinations, both when they are leaving the country and also coming back into Australia. There is discussion, or are discussions happening at the moment between the federal government and other countries as to exactly what vaccines are going to be recognised under this scheme. However, you would think that because AstraZeneca, Pfizer, Moderna, these are such widespread vaccines right around the world, they would definitely be on the list. And it is worth noting that even the Australian manufactured doses of the AstraZeneca vaccine have been recognised as a viable vaccine, for want of a better phrase there, by the World Health Organisation. But yeah, we do need to temper our excitement and enthusiasm here because there is still no clear time frame on exactly when Australia's international borders will reopen, even though the Prime Minister has said that once we get beyond that 80% vaccine benchmark, 80% of the eligible population having received their 2 doses, that it is something that will be considered for the time being. And even while those vaccine passports are in use, quarantine for 2 weeks is still going to be the prospect for those Australians and international travellers coming into Australia. However, again, the Prime Minister has noted that a shift from hotel quarantine to home quarantine will also start to happen around the same time. He's written to the state and territory leaders to outline their preparations on that issue of home quarantine. There is a trial currently underway in South Australia, but this is an ongoing process, this planning underway, and we are still a way off for having to dust off the physical old school passports that have probably been collecting dust in drawers and cabinets around the country.
Yeah, it sounds like Gladys Berejiklian is keen on starting up that home quarantine system pretty soon. So can I just push you on a bit on this, Matt? Because, yeah, obviously so many people are keen on getting a rough idea of when it might happen. Based on what you've seen so far, are you willing to give at all your best estimate on when the first planes might be flying out of Australia? I mean, there are some people flying out now and going to places and coming home. There are very few. But when it might start to be a regular thing and regular people might be able to do it without having to talk about a reason for going overseas, like seeing a loved one who might be in ill health.
Yes, so at the moment there is this process where if you do want to leave Australia, you have to seek permission from the Australian Border Force. So you are right there that people are, in fact, leaving the country. They can leave on business grounds. They can leave if they are promising they're not going to be coming back within 3 months or so. I do appreciate your offer there, Joe, to try to get me to predict the time frames here. If there's one thing that this coronavirus pandemic has taught me, it is that predicting anything to do with travel is a very fraught business, particularly when we're still talking about the prospect of domestic travel being a restriction.
Yeah.
So many people locked down either here on the East Coast in New South Wales and the ACT, Victoria, not able to go into other states such as Queensland, South Australia, WA. I think there'd be a lot more people keen to see those sort of restrictions ease before we get to that international travel stage, and I'll leave it to people much more wiser than yours truly to put a date on that one.
Okay, and so how does this tie in with the debate over domestic vaccine passports and certificates?
Yeah, so they are linked in some regards, but they are also quite different. We still don't know exactly what these international passports are going to afford the individuals that hold them once they get overseas, whether or not it's just a case of being able to cross those international borders and then they just go back into your pocket or remain on your phone unused. When it comes to this broader national debate about domestic passports, vaccine passports, there is this discussion around what freedoms should be afforded to Australians who have had both of their vaccinations, what they should be able to enjoy around the country as these social restrictions ease, going to the pub, going to their local cafe, going to an event, a concert, maybe not Gloria Estefan that you were mentioning earlier, but whoever is touring at the time. These restrictions may be put on individuals into the future as Australia starts to open up. What we do know is that states and territories are also looking at how to incorporate that vaccination data into the QR check-in apps that we've all become so accustomed to throughout this pandemic. At the moment, you can get your COVID-19 vaccination certificate. You can download it onto your phone, but in states such as New South Wales, if we use that example, we know that work is underway to incorporate those vaccination statuses into the Service New South Wales app so that when you check in at whatever venue you're walking into, it also comes up to say whether or not you are vaccinated or not. And that is something that the New South Wales government is hoping to have in place in the next few weeks, probably by the end of October there. So there is this work happening around the scenes, trying to figure out how we approach this situation into the future. And it seems like there will be some sort of certification process to see most Australians get back to life at some level of normality, Joe.
Okay, cheers, Matt. And that ageist dig about Gloria Estefan was noted.
Not
You'll
ageist
get a
at all.
retort at some stage. Matthew Doran reporting there from Canberra.